Hello, everyone. Welcome to July and a hot one as we have had a couple in a row and are going to have a couple more. So my first message is try to stay cool, use your sunscreen, and drink lots of water. So that's my first message today. Welcome. I'm Jen Robalski. I'm the director of the health department for La Crosse County. And I'll just say right off the top, thanks to one of our listeners who suggested that I get a light so that it's not so shadowed where I'm at. That's my basement's fault. So apparently by Monday, I'll have some kind of a selfie light and I'll be really with the times. So thank you for that suggestion. We're going to start out with case counts like we always do. In La Crosse County, I had hoped that we'd be able to report today that we were another day without being in the 20s, but we are currently at 21 cases so far today. So that brings our total up to 465. We have 232 of those cases that have recovered, so that's 50% of our caseload. That is better than it's been in the past. We've been at 62 or around 62% late last week even. So we're seeing that percentage come down to be less that are active and open. Our total number of negative test results for La Crosse County, this is 12,285, which means about 3.6% of all of our tests have been positive. Our hospitalization number remains at 2 and our death number remains at 0, thankfully. For the state of Wisconsin, as these numbers get bigger, I'm just going to tell you again, so we're about 29,000 positive total in the state. We went up from yesterday to today by 540. Yesterday, I believe, was the second highest number of positive test results in the state. Our total number of negatives is over 551,000. That went up by 12,068 from yesterday. The total recovered cases in the state is 79% or 23,089. And that compares, so the total recovered is 79% of the state. And in our county, it's 50%. So we have less people who are recovered, more people who are currently open active cases. Our hospitalizations or ever hospitalized number for the state is 3,482. That went up 32 from yesterday, which is about 12%. And total deaths went up by 2 to 786. A couple of clarifications around case numbers and testing. There have been some questions about whether or not our case numbers, or even at the state level, the case numbers that are reported, if those include antibody tests or what's called a serology or blood test, and they do not. Our case numbers only include lab confirmed PCR cases, not antibody tests. The second point of clarification is that we have heard from individuals who think that if they're considered a close contact and they become symptomatic during that time period and they get tested, or they're symptomatic at the time they get identified as a close contact and they get tested, if their test result is negative, that does not mean you can stop the quarantine, because there have been situations where individuals just don't test positive yet because their level of virus doesn't trigger the positive result. So if you're a close contact, you have to remain in quarantine or isolation for the full 14 days. We don't want to have folks going back to work or being back out in the community until their quarantine or isolation period is complete. So a negative test result does not get you out of quarantine sooner. And that's really because we've talked about this term incubation period before. And that is a term that says from the date of exposure in which you may have received virus droplets or picked it up somewhere and your body develops, like the virus replicates enough in your body that you might be infectious, can be 2 to 14 days. So that's the reason for that 14-day isolation and quarantine period. It can take up to that long for certain individuals to show that they are positive and show symptoms. The next thing we're going to do in today's briefing is, I am just so grateful. We have a guest today with us. Her name is Jaden. Jaden is a senior in health education at UW-La Crosse. And I just want to give Jaden huge kudos and credit for being bold and brave to be on with us today. She will share with us her story about how she came to be identified as somebody who was lab confirmed with COVID, what that looked and felt like for her, her experience with the actual virus and being ill, and just some other pieces too. So I welcome Jaden and just want to say how grateful we are to have her on. She won't be able to stay for questions at the end, but again, just grateful to you, Jaden, for being willing to share your story. So I'll let you take it away.
Okay, my name is Jaden. I'm 22 years old and I currently go to UWL. My friend ended up having to get tested for COVID through her work, and they did this was like the third time she'd had to get tested. And so she went in, and then the next day she heard back and saw that she was positive. So she immediately called me, and so me and all my roommates went to get tested the next day because they were closed by the time we found out. So we went the next day, and my two roommates came back negative, but then I came back positive. And so, I mean, I was exposed multiple times, which is kind of unfortunate, but my friend getting it, and then I was at Pettibone, and then I was at a couple local restaurants that ended up on the list of possible COVID exposure. So yeah, I went and got tested through Mayo, and they just had a drive up thing. So it was super quick and easy, a little bit painful, but not bad. And yeah, my first symptoms, it was kind of weird because I didn't really have any. I had a headache, but that wasn't really abnormal for me. So I wouldn't have even got tested had my friend not. So I'm really thankful for her. But yeah, it started out with a headache for the first couple of days, and I lost my smell like the next day, and that one was just super weird. And then my taste slowly went away, and then I ended up getting like the fever symptoms. So the worst part was the like 7th and 8th day. I had like a fever both those days, and I was just really sick and vomiting, and I just did not leave my room. And I also didn't really have an appetite during this entire thing. So I just drank a lot of Pedialyte and Gatorade, so I didn't get dehydrated. But yeah, isolation was kind of difficult for me because my two roommates tested negative, but they had nowhere else to go. So we all had to stay in our apartment. So I tried as much as possible to isolate in my bedroom, but we have like a shared bathroom space. So every time I went to the bathroom, I had to like bleach it down and completely sanitize it. And even that was like kind of scary because I was so afraid that, I mean, one of my roommates could get it. And yeah, so that was just kind of stressful. But yeah, isolation was more difficult than I thought. I thought that I was just going to be able to sit in bed and watch TV, and I didn't think it was going to be so hard, but it truly took like a toll on my mental health. And my mom came to visit though and sat outside my window. So yeah, I think that through this whole experience, it gave me like a newfound respect for masks. Although prior to this, I knew their importance, and I just don't think I took them as seriously. And now I'm like, oh my gosh. So I think it's like super important to just keep like wearing masks. And I think having like restaurant employees and like servers that have so much possible exposure, it would benefit them. But yeah.
Yeah, thanks, Jaden. I think a lot in your story rings true for others that I have heard from as well. Starting with, not having the fever and having something that you don't really think is out of the ordinary, like you said, the headache was something you'd had in the past. So initially that wasn't a huge red flag for you. I've heard that from others before as well. And also that you say that there may have been, multiple possibilities for exposure. So I think it's just interesting to hear the pieces of your story and a lot of similarity to what I've heard from others as well. I think have you heard anything from others in your age group? I just want to give you a chance if you have sort of anything you want to mention. I think there have been a lot of cases in 20 to 29-year-olds, and I think there are folks that human nature can be judgmental. I've tried to encourage those that listen to our media briefings or, follow us on Facebook or social media that really judgment isn't going to solve this problem. And I think what you've said in your story indicates that, it wasn't easy for you. The isolation period was tough. Your roommates were nervous and worried about getting the virus. I just want to give you a chance if there's anything that you might want to say to others in your age group in terms of maybe precautions to be taking, wearing face coverings, trying to be safe if we have to be in the community. What would you want to say to them?
Yeah, I think definitely in our age group, it's a college town. A lot of us here go to UWL or the Turbo. And so I think it's a lot of people go to local restaurants and they want to be with their friends, or they go out to the bars. And I think with as much of a spike as La Crosse is going through right now, I think it's incredibly important to make sure you're still sanitizing and wearing a mask if you go to the grocery store, because realistically you're putting yourself at a higher risk going anywhere. So you could have been in a COVID exposure and you wouldn't know. I think wearing a mask would be super beneficial for our cases to hopefully start declining.
Thanks, Jaden. Yeah, I appreciate that. And we're working on some efforts to see if we can make masks more available to students that are in college age, and really make that sort of more the norm. And that's not just with your age group, it's also with everyone else. And we know people struggle to wear masks all the time. Some people really struggle with that for various reasons. And yet it's one of the most simple tools that I have said in the past where we may not be maximizing and we could be to help decrease the spread. So anything else you wanted to share?
No, I don't think so.
Okay. Thank you again, Jaden. It takes a lot of bravery and courage to be on a media briefing with us. So really appreciate you doing that, and glad to hear that you're better.
Me too. Thank you.
Okay. All right. Next, I just wanted to talk a little bit about our Cooley COVID-19 Compass. We do continue to be in severe risk. This isn't a huge surprise to us because of the large number of cases that have been coming in. We hope, though, that we can see, as I mentioned, we have seen a couple of days here where we have not been in case numbers in the 20s. I just want to say that each and every day we have the ability to make choices, to do the right thing and take the right steps as individuals and as businesses. And if we do that and we do it consistently, we make it a habit, we will see these case numbers come down. But it can't just be a few individuals here and there. It has to be all of us putting in that effort. So just know that we have the chance to really bring these case numbers down if we work together and we make those good choices as often as we can. Again, at the business level, at the individual level, everyone who can take these steps and does take these steps, wearing face coverings when you're out and about, staying home if you have any symptoms, even if it's something mild, always washing your hands and really practicing good physical distancing, we'll see these case numbers come down, because that's how the virus spreads. And if we take away the virus's ability to spread, then we won't see as many people getting the virus. So We just a couple of other pieces when we are updating the data. So when you look at for those that are kind of data folks out there, our current case rate, which is the number of cases per 100,000 population, is 134.7 per 100,000. The percentage of change in cases. So again, this is the most recent 2 weeks compared to the previous 2 weeks. In the most recent 2 weeks, we had 295 cases. In the 2 weeks prior to that, it was 92. And I gave the same statistic last week with different numbers because this rolls every week. We update this. So when I said this last week, it was 231 compared to 32. This week it's 295 in the most recent 2 weeks compared to 92 in the previous 2 weeks. And that's because we've had that huge surge of cases in the last 3 week period here. As far as testing, I want to talk a little bit about testing. So as you know, we do have a National Guard testing site coming up. We are working on getting approval for a total of 3 National Guard testing sites prior to the middle of August when we no longer have the National Guard available. I give huge kudos to my team because doing 3 in a 6-week time frame is a really big endeavor to take on, considering we are also dealing with a lot of phone calls and emails and a lot of cases and contacts. I'm just really proud of my team. That says that they really want to be able to bring testing to our community. They know it's important to you. So I just really push that kudos back to them because they're the ones that are making that happen. So we'll announce in the near future the other 2 dates. The first one will be at Logan in La Crosse on July 10th from 10 to 6. And again, those are for anyone who has symptoms, even if they're mild, any symptoms of COVID-19. So watch for details on our social media page and website about those testing events. We do, and I have spoken previously about our testing capacity locally. We know that at the state level, because capacity is not strained everywhere in the state, and in addition, in the state of Minnesota, that they are opening up testing such that they are allowing more individuals, particularly those without symptoms, to be tested. That can be confusing and frustrating because if you live in Minnesota, but you doctor here in Wisconsin, and you're seeking to get tested, but you don't have symptoms, we don't currently have capacity to support that need. In addition, there have been times where a state disease investigator, because in the past few weeks, we've had to take some of our cases and our contacts and send them to the state. We're working really hard to improve capacity so we can take those cases back. But I think, they use information based upon the state's overall status. And I do know of at least one situation where someone was told from a disease investigator at the state that they could get tested even if they weren't symptomatic, and that isn't the reality locally. So I understand and appreciate that can cause frustration. But right now, we have in the past, and tomorrow again, we are meeting with our healthcare partners. We're really trying to understand in detail how many tests we can actually do for what types of situations. So we know that healthcare facilities do tests for pre-procedure. They also do tests for those that are symptomatic. They also have a regional footprint, not just La Crosse County. So we want to get a really good handle on what those numbers are, where the testing is being done, how we can increase capacity, because all of us are interested in getting to the goal of testing more, including those that don't have symptoms, particularly a close contact who isn't symptomatic. We'd love to be able to support that. Unfortunately, we just aren't there with our levels of capacity across the resources that we currently have, which are predominantly right now in our healthcare partners and through National Guard testing sites. We are also advocating to the state to try to make sure that the National Guard could be available longer than mid-August, but at this point, that's the understanding we have, is that they won't be available after mid-August. Couple reminders, as I did on Monday, we are approaching a holiday, and it's really nice to celebrate such an important holiday for our country with the 4th of July. Just again, we are not in a place with the level of virus in our community that we suggest gatherings, particularly large gatherings. We know, however, that there are some plans for that. We know people have taken out permits to do fireworks on their own. We know that there are locations in our county, perhaps surrounding counties, where fireworks displays will be happening. It is much, much less than it has been in previous years. That is, I think, attributed to the fact that if we don't do those events properly, we can see spread of the virus. So please know that if you are going to gather with those outside your household, or you're going to go to an event where fireworks are going to be displayed, my strongest recommendation is that you physical distance 6 feet away from anyone outside of your household. Of course, it should be outside, even if it's at a private residence. If you're doing any shared spaces indoors, that raises the level of risk for spread. Any common touch surfaces. And of course, if you're outside, even if you're outside and you're physical distancing, also wearing the fabric face covering or some kind of covering to prevent droplet spread in case you have the virus and don't know it. So please, everyone who is engaging in those activities, even though we don't recommend that right now, if you do, take those precautions so that we don't have a huge surge of cases coming out of the 4th of July holiday. And then I think, just as a closure before we take questions from the media partners or those on social media, just a message to say that I want to empower all of you as individuals, as businesses, no matter where you work or live in the community. It is really important for you to take the recommendations seriously. Help us work together to prevent the spread of this virus. With that, I'll take questions.
Hi, Jen. Marcus with News 19. I was wondering, so when we're talking about decisions, what was the decision process behind deciding not to roll out any similar restrictions that like Dane County did today? If with like our history of recommendations not necessarily working when it came to an increase in our recent spikes?
So sorry, Marcus, but I'm not sure what restrictions that Dane County rolled out today. Could you share those with me?
Yep, it's just restaurants. You can't dine inside anymore. It's just curbside pickup that they can do, and you can't be in a bar. Gatherings are permitted for individuals. Only 10 of them or fewer, not included employees, and 25 for outdoor gatherings.
So really the difference there is that they have ordered those things and that we all along have been recommending them based upon the data. So we're in severe risk, and it's very clear on our compass under the recommendations table that those are the same recommendations that you just listed, the same ones that we have. The difference there is that they are ordering those things to take place. And so this does come back to the level of authority that health officers have in the state of Wisconsin. And we've been seeing some discrepancy in that level of authority and the understanding of what that is. So there is a risk for any order, no matter what it's regarding. And I think that we just don't know that level of authority is sure at this point, especially if you're going to be broad sweeping across certain types of establishments or certain business types. We do have the authority to write, as I've said before, if there is a specific business that has a practice or a guideline or something they're doing and they have cases associated with that business, and we're really concerned and we're not making progress with them when we try to communicate and work with them to get precautions in place to protect their employees and their customers, as an example, then we can write an order relating to that specific business. It is not my understanding that the health officer authority is clear around writing broad orders across sectors of the community.
Hey Jen, I just wanted to get your thoughts on the logger season starting this week and the potential that would bring for large gatherings without face coverings.
Yeah, I am concerned about it. I'm concerned about the speedway. I'm concerned about any activity that brings folks together in, even though it's an outdoor space. Those are not in alignment with our current recommendations. We have spoken, our environmental health staff have spoken with those at the loggers, and we've tried to tell them what we would want to see them doing. They did some of those recommendations, not all. I believe one of the things is they're doing a 50% capacity, but that still is a lot of people. And I think there still is risk there. I've seen other communities like Eau Claire and their league not be in session. I struggle with it, frankly. I think it brings risk, and I know that we want to balance that with individuals who want to be at events like seeing baseball. This is no different than what's happening nationally. I think that if we don't do those types of events right, we may see outbreaks and cases, and that does concern me. So my message is that if you're going to attend one of those events, that you take every precaution and you understand that you may be putting yourself at risk, just because we really shouldn't be having those kinds of events right now.
Marcus with News 19 again. Just I'm curious, the comparison between Minnesota deaths and Wisconsin deaths, the numbers are pretty different. I think 1,445 in Minnesota, 786 in Wisconsin. Do you have any idea of why that is?
Without looking at the data, Marcus, I wouldn't be able to say for sure, but my hypothesis would be that it may have something to do with impact at various types of businesses. So for example, if you have a long-term care facility, and we saw in Winona, if you have a long-term care facility that is significantly impacted, the number of deaths you're going to see out of a situation like that is vastly different than when you have cases in like we have in a large number of individuals that are generally healthy. You aren't going to see the same level of deaths. So it has to do with where the virus is, where it's spreading. In our own county, I can say, especially in the long-term care and assisted living facilities, we have been concerned very early about those facilities, and those facilities have come to the table. They're part of a strike team. You've heard Dr. Lofi from Mayo and Dr. Cogbill from Gunderson talk previously on these briefings. They're working really hard to make sure that these facilities have what they need, and the facilities are working really hard to assure that we keep the virus out of those settings. So those are the types of places where we will see larger numbers of deaths. So my hypothesis would be that it comes back to who's being impacted and where, because if that is predominantly in populations that are older or are immunocompromised, then the likelihood of death is much higher.
All right, thank you. So on your guys' outbreak page, what has to happen for a grocery store to be listed as high risk?
So any location that is considered a public establishment, like a grocery store, if they have a case associated with that establishment, a lab confirmed case, then they would likely be listed under low risk. So you can see there's a flow chart actually that helps you identify what they would be listed as for high, medium, and low risk. what makes those types of risk determinations happen. We've tried to be as transparent as possible about that. But it really comes back to a lab confirmed case that was in that establishment. Obviously, the risk level for employees is higher if it's a staff member, because it's the likelihood of the interaction being close contacts is higher. But essentially, that's what it comes down to, is a lab confirmed case.
And then Jen, I know you mentioned you have 2 hospitalized in La Crosse County right now. Is there any update on the condition of those individuals?
Yeah, I'm sorry, Haley. I don't have an update on those individuals at this time. I'm not aware that they are in critical condition, however. So they have been in the hospital for a while, but they are, to my knowledge, not in critical condition.
Jen, we are getting some questions from Facebook about our current risk level being severe and what it would take for it to become high risk or orange instead of red.
Yeah, I've gotten this question in the past. And again, I don't have an exact number, but when you look at, or an exact answer, but when you look at what goes into the metrics that sort of raise up those indicator lights of green, yellow, red, what we look at there, and then overall there's an orange as well for high risk. We look at the epidemiology side, which is things like case numbers and the percentage of change in cases. We look at the healthcare side, which is how many beds are available, what is the PPE or personal protective equipment status in those facilities, and that continues to be okay. And we look in the public health capacity side, which is how quickly can the cases be reached after they're tested, how quickly are the tests put into our surveillance system so we know they're there, how quickly can we identify contacts and reach those contacts. So we, with the large number of cases we've had coming in so fast and furious, it's been difficult to reach those cases quickly, to reach the contacts quickly. We have situations where individuals will not take our call or won't answer our call, won't return our call. We have situations where individuals won't give information about their close contacts. We have had to start being a little bit more assertive in that area by sending a certified letter to indicate that they need to give us that information in order for us to assure the safety of the public. So we are taking steps to make sure we can connect with more. But a large part of it is just the sheer number of cases that have been coming in and how many contacts those cases have is a lot to keep up with at any one time.
Jen, and we have a lot of questions today about masks and whether or not that's something we would mandate.
Yeah, that's a great question. I appreciate that question. I want to be really clear. We can't enforce something like a mandate of masks or face coverings across the whole population. I mean, just think about the details in such an order. Even if we had the authority to do that, which I don't believe we do, we would never be able to enforce such an order. And if you can't enforce an order, then it isn't a good order and it shouldn't be done in the first place. Again, even if we had the authority, which I don't believe we do. So a county-wide, mask requirement just isn't possible. Now, can there be an order for a specific business to do that? Perhaps. Again, if we have communicated with an establishment, they have cases associated with it, they're not taking precautions, and we really need to make a change at a certain business to help make it safer for the public, then yes, we can take those kinds of actions, but not at a broad, global, everyone type of level.
So when companies or businesses or maybe even schools reach out to you and say, we want to require people to wear masks in our facility, and then they ask, what do we do if people refuse? What do you guys tell them?
Well, I like that you bring that up, Marcus, because one of the things we've said before is that businesses can make their own requirements. They have authority. So this doesn't just come back to a health department or a county or a city government making an order and just enforcing something on everyone in the public. This needs to be a balanced approach, and businesses and entities that have employees can make their own requirements, and they need to have a mechanism to enforce it. How they do that, can be problematic. Again, if you can't enforce something, is it really a good idea to order it in the first place? But there are creative ways to do that. So, for example, when we were looking at enforcing on the downtown campuses, the tobacco-free campus piece, we talked a lot about this. And we do have the ability to cite individuals if they are violating that part of our ordinance. But really, it could be as simple as having mechanisms for staff and coworkers to check each other, and you have sort of a collegial self-monitoring process to try to get that compliance in place. Of course, that's not the end all, but again, getting creative with some of those ways to enforce something that you believe is really important to decrease the spread of a virus that can take people out of your establishment and make it really difficult. I mean, I'm concerned about this with schools. I'm on a school board myself, and one of the things I talk about is, we don't want any staff or kids to get sick. But if that happens, how do we make sure that they're not, they don't have just a ton of close contacts, and especially with regards to the staff. If you take out a staff member and they had close contacts with all those kids, and then you don't have a lot of staff members who can come in and replace them, that makes it really difficult to have school. And so that's where an active monitoring program would be really critical, so that it's part of educating them and making sure they understand any minor symptoms, and you really shouldn't be at work. You support them to stay home if they have any minor symptoms, which is hard, but necessary. And then, you screen them when they come into work each day. You ask them detailed questions about any of the symptoms on the list for COVID from the CDC website. You can take their temperature if you need to, and then you record that information so that at least at the beginning of every shift that they're coming to you, you know that they aren't symptomatic. And that way, if somebody tests positive, which is still possible, they cannot be symptomatic, or they could have been at work in their pre-symptomatic stage. You'll know exactly, who that person had been in contact with. You'll be able to say, we did screen them, they weren't symptomatic that day, which does make it, a little less likely that they may have been spreading the virus at the time. But still, the more things you can have in place to understand, what's happening by the day, the better, because otherwise the part of the challenge with this virus is it can already be spreading before you even realize you had a positive case in that establishment. If somebody doesn't get tested right away, if they don't pay attention to their symptoms, if they're working while infectious and those things aren't in place, you won't catch that as quickly.
Any other questions for Jen today? I don't see any, Jen.
Okay, well, we are heading into the 4th of July holiday, so be safe and take precautions and have a good time. Enjoy yourselves. This is an important holiday for our country, and just be safe out there, and we'll see you next Monday. Thanks, everybody.